Hello everyone. My name is Yash, and I'm a part of Heath Matthews physio team. And today I'll be talking about injury prevention. I hope I'm audible to everyone, and everybody can understand what I'm saying. Uh, so basically, what we are going to discuss today is injury prevention. I'm sure you would have had many seminars. You would have read about it. You would have heard from the coaches, from peers, everyone. But it's a very broad subject in a nutshell. So there are a lot of components which comprise in terms of injury prevention. My attempt and the sole purpose behind having this injury prevention, which is a very common topic, is to make the athletes as well as the parents understand certain key factors and the basic understanding of how an athlete, the coach, the health system basically, which comprises of me and the sports science, work together in terms of getting a high performance situation from an athlete. So that is the sole purpose behind this very common topic over here. So I'll start with that. So injury prevention primarily, basically, it depends upon three factors: primary, secondary, and tertiary. Primary will be health promotion in terms of understanding what are the do's and don'ts, in terms of understanding what are your individual weakness and your strengths and how to go about it as an athlete. And as a parent, understanding your child's capacities and incapacities. Secondary is early diagnosis. I think someone's mic is on right now. Could you please turn it off? Thanks. Yeah, secondary would be early diagnosis and intervention to limit the development of disability. Basically, what it means is that if you have a problem while you're swimming, or then while you are doing some dry land training, or for that matter, anything, something happens at the school or something happens anywhere, it is important that you communicate to the right person in the right time before taking it too long or taking it lightly, that it's a simple thing, let me see, we can take care of it later on. So the sooner you get it diagnosed and find the root cause of any discomfort or any ailment, it is better, so that we can start working on the treatment factor. If the diagnosis is not done at an early stage, then itself adds up as a problem at a later stage. So early diagnosis and the intervention at the right time plays a very important role in prevention. Do not take things lightly, no matter how easy it may seem, basically. And tertiary is focus on rehabilitation. Once you have got the diagnosis from the physiotherapist or the doctor, then you need to adhere to what has been recommended. You need to understand and follow the rehabilitation program or certain medication whatsoever has been suggested religiously. Compliance is a key factor over here in tertiary prevention. You need to, as an athlete and as a parent, understand the complexity of the problem and work on the solution which the health practitioner has provided to you. So these are very important and seemingly very easy to understand, but makes a lot of a difference in terms of the prognosis of the injury. Now, in terms of having a conceptual approach to injury prevention, what basically this slide I'm trying to explain over here is identify the magnitude of the problem. So, in essence, what it means is that do not take things lightly. Understand what the problem is. If there is a wrist pain, then understand why there is a wrist pain. Understand how difficult it is for the athlete to swim with that kind of pain. So basically understand why and what is leading to that pain. Identify the risk factors for the injury mechanism. It's also, now that it is established that there is a certain amount of discomfort in a certain particular area, you need to understand what is adding on to the problem, what is adding fuel to the fire. and what led to it. Sometimes it can be some blunt trauma, some sort of a collision, you hit yourself somewhere, or sometimes it can be because of an overuse injury. You've been training hard and you've not been able to rest well, something has gone wrong. So it is important for the athlete as well as the parent and everyone in the team to understand and identify what can add to the current problem, what can add fuel to the fire. Now the third part comes to introducing the measures that are likely to introduce during the future. Now understand how to deal with it. How do we tackle this problem and have a complete well laid down program. There is no gray area. It's very crystal clear. You understand the problem, you have a program in front of you, you follow that, and it leads you to a certain result. So this clarity is very essential for everyone in terms of managing injuries in the right time, in the right manner. And again, if there is a problem after that, step 3, you got to go back to step 1 and reevaluate. If there is problem which is still persisting, say for more than 3-4 days, and if you're still not getting the kind of relief, or you want to, still not able to understand the exact problem, then you go back to step 1 and follow the whole process again. But this is very essential. Now, injury causation model. So now I'm going to share a slide wherein I'm going to describe various factors which lead to an injury. Everyone needs to have a broad understanding of what can cause injury. It can be happening from factors which are within you, internal, or it can be happening from factors which are from outside sources, like external. So please have a close look at this screen. So over here, there are internal factors like age, gender, body composition, fat mass, health in general. If you've not been keeping well, if you're down with some fever, if you already have some previous injury, physical fitness, your current state in terms of how strong you are, how good you are in terms of an athlete, in terms of sheer build and power, anatomy, skill level. These are intrinsic factors. Then there are external factors, human factors like teammates, opponents. So in our case, it could be a simple thing like the lane ropes. There are so many instances where people are doing their strokes, they're swimming, and then sometimes the hand gets caught up in the lane, and then that causes a little bit of an abrasion over the fingers. So that these kind of things are an external factor. The quality of the pool and the quality of the water also falls into some external factor. The environment, basically, like rainy season, or if it's winters, then the cold water. These are all part of the external factor. Now, anything from internal to external may lead to an injury. There is no specific areas, or there is no demarcation where we can say that external factors have a higher chances or have more prevalence, or internal factors. It can be anything. There can be, we cannot have a very concrete understanding that this is more than the other. We have to understand this in a holistic manner, that everything comes together. Now, the other thing which also is usually not taken care is the inciting event. What that is the playing situation, player opponent behavior. So what happens during the competition, the way you are mentally toughened up, or the physical factors in terms of how things are, the adrenaline rush, these are also key factors in terms of injury and risk management. Sometimes people get nervous, sometimes you're not in the right frame of mind. That might give you some sort of a deviation from your focus, and it might lead you to trouble. So these are very less but very important factors as well. This broadly, the whole thing comes together as an injury risk kind of a factor. Now, developing a surveillance, there is a certain strategy which we as health practitioners and sports science specialists follow. for us to understand, or for us to even tell you that certain things are more common, or we have to collect certain data. That is the very now we've been collecting a lot of data on team builder. We've been behind people's lives, almost everyone's life, like put this, put that, and give the AM wellness recording, give the PM wellness recording. So there is a clear reason behind it. Unless and until I don't gather the information I want, I cannot understand what is going on in a broader perspective. So now that we have collected data, when the athlete and the parents are communicating with us, we come up with a graph, like this simple graph which is being seen right now. So I can understand that shoulder is something which is more prominent in terms of injuries. Back is an area, neck is an area. So over a period of time, we will understand month by month that which area is of maximum concern for a swimmer. So for that, and on top of that, once we understand this is the area of relevance, we design certain exercises, we design certain protocols, we design certain warm-up strategies, we design certain exercises. We call it as prehab. There is something called as a rehabilitation, and then there is something called as a prehabilitation. There is a difference between the two. Rehab is when you have got an injury and you are trying to recover from an injury and going back to a pain-free zone. Rehabilitation is something that you are not injured, but you know your weak points. Like you understand that shoulder is something which is a little tricky for me. So you work on those areas and you have something called as a prehabilitation program. I cannot come up with a prehabilitation program which is 110% effective till the time I don't know what is the main concern in my group. So right now in our swimming population, odd and around 100 to 120 swimmers, we need to know as health practitioner which is the maximum area of focus we need to work on. But that can only be achieved when I get the information, when I collect the right kind of information from the athletes, from the coaches, and from the parents, all put together. So this is very, very important. So once we collect the data, we prepare these kind of graphs, basically. We understand. And this is a very, very useful information for the coaches as well as the athlete to understand that, in the month of Jan, there are so many injuries. In the month of March, suddenly the injuries spiked up. What could be the reason behind it? Was it competition? Was it something that the summer holidays going on, people doing a lot of activities apart from saying people playing another sports? So we don't know, but this broadly gives me a graph, and which makes me understand whether the team or the athlete are heading in the right direction. The sole purpose is to win medals and be pain free and injury free. But to do that, we have to understand what are the trends, basically. So the screen which I'm sharing right now, which you see the graph, it gives me a clear idea that forearm is the cause, 43%. So I can prepare a strategy and come up with a plan so that this can be prevented in future. So there is a definite reason, or there is a rationale behind we taking the information and coming up with such information. This we communicate with the coaches so that they also understand what is going wrong and which is the key area. And the sports scientist understands these issues and comes up with a strength and conditioning program which takes care of these anomalies. These are the anomalies.
Yes.
Yeah. Okay. So I hope this is all visible. Is this visible?
Yeah, yeah.
Yes, sir.
Okay. Fine. So this essentially, basically, this is the kind of data we uh, collect, and at the same time, these are the kind of graphs we come up for everyone's understanding, right from the coaches to the athletes to the parents. Next, simple question is how do we collect the data? So we use these kind of things. We have Team Builder, and soon we are operating on the Heath Matthews website as well, which has the same kind of a program where we collect all the necessary tracking essentials in terms of wellness, all the data which we are currently collecting. Then we are using Google Documents in terms of understanding the people who have been present for the sessions, not been present, and other essential data. Now, the third is clinical documentation. We also keep a very close look at the injuries in terms of documenting. We have a historical data for, say, over a year in terms of who was injured at what time and what was the exact diagnosis. So, any time in future, say someone, if it's a recurrent injury, someone has got injured again for the second time during that over the same particular area, so that this documentation helps clinicians like us to go back in time and understand what the problem is. If this kind of documentation are not present, then it becomes a very difficult situation for us to correlate and connect the dots. So documentation is one very important aspect which we are very particular about, and communication, which holds true for anyone in terms of managing a high performance team. It has to be communicated well internally between the team, between the coaches and the sports science team, as well as the communication has to happen from our end to the athletes as well as the parents, and make them aware and understand what the problem is, and help them out with a good strategy and a solution to it. So this is how we collect the data. What do we record? Uh, we record participation, basically attendance in a very simple manner. Who has participated, who has not participated, basically in terms of that day's workout. And within that, if we have to take a deeper dive, then each and every exercise have been done or not been done. All those things, right to the minutest level, has to be taken care of. And overall training volume. So once we start collecting these things in bits and pieces, eventually what we have at the end of the day is the complete training volume. That is not solely restricted to just swimming. It is also it also encompasses your dryland training volume. So everything pulled in together, we can understand where the athlete is in terms of the efforts which he or she is putting in. Performance. We also have certain test sets, like the coaches have certain test sets. Even we from the sports science team have certain test sets, and on those basis we come out with certain graphs and metrics which will help us understand and give us an information whether the health and fitness has been compromised, or is it improving, or is it deteriorating. So all those things also are being recorded in terms of understanding whether the performance is going up or whether the performance is going down. And symptoms essentially, basically what I'm meaning is the complaint on and off, day in and out. If there are any complaints like soreness or any injury or some sort of pain or some sort of discomfort, any information relevant from a swimmer in terms of something that affects their performance comes under symptoms, basically. So these are the things which we collect. Now, there is another crucial aspect which is called as season analysis or risk profiling, the training and competition program. So, the whole idea is to prevent certain things from occurring. And in order to do that, we need good information well in advance. So, this is how we do. We do a risk profiling. Season analysis represents an attempt to identify risks before they occur. How do we do this? We take care of certain parameters like the competition schedule, the training program, recovery, travel. We need all these information well in advance, so we know how to plan something called as a micro, meso, and a macro site. We collect from the questionnaires and different kind of sources the sleep disturbances, change over from heavy pre-season training to competition. Now, this is something again we will understand once we understand the workload. How much effort has been put from the athlete side, We also get the information from the coaches in terms of what kind of training program they were on. So once we have both the details, we understand what is the amount of load they are going to, they had endured in the past, and they are going to endure in the future. Return to play after mid-season pause. So if there is some sort of a pause in between, then that also is very essential for us to understand. During that pause, also what the athlete was doing. Was there minimal amount of training, something called as a Fartlek training, that is an off-season training? Has there been some sort of an activity which has been happening from the athlete side, or there was a complete rest, like somebody went on a holiday abroad and there was absolutely zero exercises? So this information also needs to be there. Now, beginning of final rounds. Again, once we have a clarity in terms of how the schedule is in terms of competition, we understand the tonnage and we understand what things need to be done. Uh, Increased training and competition load, change in climate, selection of important events. Basically, it explains us about the clarity which we need to have in terms of making a program and making sure that we are well ahead of the curve. Uh, so there is a certain way by which we use this data and come across in terms of having a strategy. So how do we do this? Periodic medical and physical assessment. So once we have that raw data which I shared in the previous slide in terms of knowing the competition dates, in terms of understanding where the athlete was active or whether the athlete was not active at all, what we do is we come up with certain periodic assessments, physical as well as certain blood related tests. Hello. Yeah. So, how do we do that? So, we need to identify illnesses, injuries, and chronic medical condition. If an athlete has an history of back pain, or say, for example, ankle injury, then that has to be communicated to us, and we have to constantly keep an eye on it. We cannot neglect it. When I know for a fact that there is this person who is has a history of recurrent injuries over a specific area, I need to give that person some special attention so that that injury doesn't flare up at the time of competition. We do not want the efforts being drained out at the end when there is the point where you actually have to give in your 110% because of some problem which was there in the past. So it is very important for us to have an understanding of the previous history also. Now, identifying factors that increase. This is something which I explained you earlier in the graph which we had, not the graph, in the slide where there were intrinsic factors and the extrinsic factors. So I need to understand what are the factors which could, so in simple terms, it could be tightness. Many of the swimmers have inherently, tight certain group of muscles. So I can only understand this when I have evaluated, when done some concrete assessment from my side. So I know that X individual or X swimmer has certain shoulder related issues or neck related issues, and I have done certain assessment. So this gives me a clarity so that we can come up with something called a custom tailored program. It cannot be generic. What we are trying, what we are going, and what we are doing for each and every athlete is having a custom tailored program. No two individuals are same. So that is why once you collect this information, it can go down to a level where everything can be specifically tailor made for that particular swimmer. How do we do the periodic assessment? We do musculoskeletal screening. So ideally, we do it every 3 months. The whole musculoskeletal, many of the swimmers have already gone through this process. So I'm sure you would have understood, you would know about this, how we do the musculoskeletal screening. The other aspect is the fitness, the strength and conditioning part. We would also want to understand, apart from any musculoskeletal anomalies, where do you stand in terms of your current strength and fitness level? Has there been some decline, or have you not improved? If you've been working hard, you would obviously want to get better. So this fitness evaluation over a period of time, so if I've done 3 fitness evaluation in a year's time, I understand from the first month to the ninth month, whatever efforts I have put in, has that given me the kind of benefit or not? So we do fitness evaluation for that sole purpose. Blood routine analysis. This is again a very neglected kind of a thing, but very very essential. Sometimes we are putting a lot of effort, like physically. We are doing everything, we're giving all our efforts from the heart and soul, but still we do not get the kind of result. So what is the factor which is not giving us the kind of result? So sometimes the blood routines, certain things like vitamin D3, B12, your basic other metrics help in terms of recovery, which are helping in terms of recovery, are not taken into consideration. So blood routine analysis gives us a clear idea if there is any sort of insufficiency or deficiency of certain micronutrients which are essential for you to recover. Today, if you have worked hard and you've given your 100%, 110% in your pool, in the pool, and in the gym, I expect that you give that on an everyday basis. If you are not if you have not recovered from today's session, maybe the swimming or the dry land session, and if you are not fresh for the next day's workout, then there is something which needs to be looked into. So blood routine analysis gives me an insight whether the body is able to cope up with the kind of stresses you are enduring day in and out. This is a very important marker. So this also needs to be happening on a periodic basis. Most of us are short of D3 levels. Most of us are short of B12 levels. And what happens after 6 months, we realize, oh, we don't know what went wrong. And then we go for a blood test and then, oh, so the levels are, so body is not able to, recover on its own. So if we do this on a timely manner, we can prevent a lot of things, or prevent soreness, prevent a lot of injuries, if we know for a fact that we need to maintain a certain level of, it's like how you're maintaining your body weight. You check it on a regular basis. Oh, I weigh 50 kilos, I weigh 45 kilos. The blood routine also is as essential as calculating your body weight. And nutritional assessment. We've already had a talk from Ananya in terms of understanding how important it is for the athletes to follow a structured diet, because that has a direct impact on your recovery. And if your recovery is not good, then you are playing with the fire. If your recovery is not up to the mark, then you have a high probability and you are in a high risk group of getting an injury. Simple. Now I'm going to share with you a very simple injury prevention program. It's just, again, this is a generic program. I would say that I would want a custom tailored program for each and every swimmer I have. But just for your understanding, I'm going to share a sample program. So this is a warm up which I would have devised for a X or Y swimmer. So you start with half burpees, then plank, then side plank, low plank, butt kicks, knee taps, squats, flutter kicks. So there is a lot of science and thought process put into this kind of a workout. It is not just random exercise picked and put in together. The reason behind this is very, very scientific, which I want the swimmers as well as the parents to understand. When a sprinter is going to start his session, we want a program or a warm-up which is going to activate the kind of muscles which are going to be used in the pool. So we devise a warm-up program which is going to target those organs and those muscles. So the exercises we choose for the program, for the warm-up, are very specific to the outcome which we want at the end of the day. Now over here, if you see, the duration is not more than 45 seconds. So on and all, if you do these 11 exercises without rest, it will not even take more than 7 minutes. Now 7 minutes prior to jumping into the pool has a profound effect later on at the session, at the end of the session, and it has a huge impact in terms of minimizing injury. So it should not be large in terms of volume. I don't expect people to be warming up for 20 minutes before jumping into the pool. No, that's not what I intend to do. It has to be short, it has to be effective, and it has to be targeted towards the muscles which are going to be worked upon in that activity, in the swimming session. So it is very, very specific and tailor made. So this 7-minute warm up program will have a very good effect on how the session will be, in terms of, the session, at the end of the session and during the session. Now, this is a warm up which we can do before the session starts. Now, this is an exercise regime, or you can term it as prehab, something which I have explained before right now, just a few moments ago. So this is, so again, how do we come up with this kind of a prehab? When I know for a fact that there are certain key structures. So rotation over the shoulder is one thing which has been which comes across as a major hindrance. Rotation is restricted. So once I know what are the problems, I come up with a program like this. Core has to be emphasized upon, shoulder mobility has to be worked upon, hip mobility has to be worked upon, pushing strength, pulling strength has to be worked upon, scapula. So the exercise which you see right now have been devised in a way wherein we have considered the major issues which we have found in the swimming population, as well as understanding that what are the key structures which always have to be worked upon. When you do a strength and conditioning program, it is there are the gross areas which you need to work on, and there are minor areas which you cannot avoid. These are these key areas which you cannot avoid irrespective of how powerful and strong you are, because this has a direct impact in terms of injury. There is a difference between you being strong, and there is a difference between you being prone to injuries. Just because you are strong doesn't mean that you are invincible or you will never get injuries. You are as strong as the weakest link. That is the key thing which I want to communicate. You are only as strong as your weakest link. With this kind of a program, we are trying to make the weakest link into your greatest strength. So there is a lot of science, there is a lot of thought put into this kind of program. So please follow this program. And when the sports science team is giving you this kind of program, there is a lot of reason behind it. Now, this is a simple stretching program. Of course, again, that would be custom tailored to the program which has been done. And certainly certain people who have, some swimmers say that I have tight hamstring. Some people say I have tight quads. Some people say I have tight neck, trapezius muscles. So you have to have that kind of understanding and stretch those muscles on a daily basis. You don't need to wait for me to tell you. You should have your own program in front of you. Now, there's another thing which is called as relationship between load and injury. Now, slowly I'm transitioning towards sports science. It might be a little difficult for the parents to understand, but I will try to explain it in a very simple manner, as simple as I can. So just hold on. If there are any questions later on, I'm more than happy to clarify. So relationship between load and injury. So please get this. I hope everybody is able to view this. So limiting total amount of training and competition is likely to reduce. So in essence, if you want to reduce the risk of injury, what do? You reduce training. But that is not going to be accepted. So for coaches, this is a very interesting area which I would want the athletes and the parents to also understand. Just because you don't want to get injured doesn't mean that you should stop working out. Essentially, as an elite athlete, the coaches and the athletes would want to train harder to maximize the performance. So if we train harder and if you're maximizing the performance, you're putting your best, then it directly puts you in harm's way. And no, that is a myth. So you can find a midway where you can prevent yourself from getting injured, at the same time keep delivering your 110%. So this is kind of a confusing understanding which people have. So it need not work in this way, where if you want to have less injuries, suddenly you start dropping out on things. No, you can still work on 110% effort from your end and still be at a minimal risk of injuries. Now, the other thing is load tolerance. So for example, if I say somebody has to lift 25 kilos, not no two people are same in terms of strength and endurance. There will be some people who are weak, and there would be some people who are relatively stronger in comparison to them. So when I give 25 kilo weight to somebody who's strong, for them, that person, it will be very easy as a task. It is 25 kilo is nothing. But that same 25 kilo, if I have to give it to a relatively weaker athlete, then it will be too much of a task for that person. They will be exhausted at the end of the day. So what is the question over here? Is 25, so I cannot judge them based on 25 kilos. Everyone's capacity is different. So load tolerance is also a very key factor in terms of making sure that each person is on the right kind of load in sync with their current physical capacity. Okay, we will further deep dive into it. So this brings us to something called as a training injury prevention paradox. Some studies have shown that high training loads may indeed be protective against injuries, most probably due to enhanced physical resilience. It's like immunity. If you are immune to certain things, then you have less risk of getting any sort of health problems. So if you are physically doing good in terms of exerting, doing the right kind of things in terms of exercising, loading in a good way, then that makes you immune, that makes you resilient to certain injuries. So this is a paradox which people need to understand, that it is not always that if something is overdone, then it causes it. There is a way where you can find balance between making sure that you give your best at the same time at the minimal risk of getting injured. So how do we do that? So rather than limiting the absolute amount of training and competition, rather than reducing their overall volume and workload, what do we do? What can we do? We need to manage their rate of load increase. It has to be gradual. If there is a sudden spurt, basically from zero, if we just scale it up to 10, then it's going to be a little difficult for people to handle. But when we have a very well laid down curve and a strategy, when we increase it in a very controlled manner, it can be absorbed well by the body, and that makes you less prone to injuries. Second link is managing acute to chronic load ratio. Now, this is a little technical terms. So, what basically it means is that we know what your workload is over, say, 4 weeks' time. Now, today I compare that 4 weeks workload to a day's workload. I divide acute to chronic.
Yes, you're in mute.
Yes, you have muted yourself.
Can everyone hear me now? Can anyone, everyone hear me now?
Yes,
Yes, sir.
Yeah, okay. Thank you.
yes, sir.
So your voice is breaking.
Okay, I'll keep in mind. Are you able to hear me now? Okay. So this
Yes,
is,
sir.
yeah, so this is the kind of
Yes.
drive which I would want people to understand, that even if you, so basically, even if the workload has increased, the rate at which the injury risk is has to be minimal. There are certain zones which come across over here: undertraining, optimum, overtraining, overeating. So anything about 1.5 is basically dangerous. That puts you in a harm's way of getting the injury. There is another graph which I would want you all to understand in terms of understanding the acute to chronic. So acute to chronic load ratio has been linked to, I think someone uh, not muted their mic. I would request you to please mute. Okay. So over here, if you see the graph, basically what it explains is that if you see week 4, 5, and 6, there has been a sudden drop in terms of sessions. And after that there has been a sudden spike basically, and it goes beyond 1.8, 1.5. 1.5 is the threshold, but beyond 1.5 I term it as being at a high risk of getting injured. So so the drop could have been because of certain exams, or if there was some injury or illness, say something like malaria, people have not been training, that person would have been out of action for say 3-4 weeks, and after that there is a sudden increase in week 6, 7, 8 in terms of their training load. So if this sudden spike puts the athlete into a very high risk kind of a category of getting injured. So had this curve been a little bit more mellow in terms of, rather than having this sharp spike, if it was gradually transitioned, then you are in a safe zone. So you would want to be somewhere around 1 or 0.8 level, so that the transition is smooth. So that way the workload is also improving. At the same time, you are not at a high risk of getting injury. This sudden burst is something which needs to be looked into by the coaches, and obviously not the coaches, just the coaches in terms of the dryland training program also. We cannot push somebody to a next level altogether when we know for a fact there has been certain decline in terms of their effort. Now, how do we understand? So there are, in understanding this acute to chronic load ratio also, there are certain things we collect. There are certain internal factors, intrinsic factors, and there are certain external factors. Intrinsic factors such as RP, the simple scale right now. People don't understand this. I just want to throw light on this. This is a very important scale in terms of me understanding how much are you pushing from your end. So 1 is very light, 2 to 3 is light, 4 to 6 is moderate, 7 to 8. So after each exercise session, or say each training session, we ask these questions. That is there on their team builders. It is there on, we ask them in person also, that please give us this rating. So if an athlete has been constantly saying that, I have been quoting 9 on 10 for consecutive 3 to 4 sessions, then that is something which we need to look into. Why? Was the set easy? If the set was easy, but still the athlete is saying it is 9 on 10, then why is it so difficult for the athlete when the set is relatively easy? So then we need to understand, assess the athlete. What is the problem? Are they not able to push themselves? Or for that matter, that load which we have made for that athlete is not right or adequate, then we will lower it down. So this gives us a feedback. This gives me an information whether you are overdoing or you are underdoing. Unless and until I don't ask this question, I will always be clueless in terms of understanding where you stand. Then there are other metrics also, like we do a lactase test. Then there is heart rate, lactate. These are also objective parameters using which we understand whether there is overtraining or whether there is undertraining. If the heart rate is high, then obviously they are pushing themselves. If the lactate results also gives me an insight whether the body is recovering in the way it should. Ideally, I would want people to give their maximum and have minimal amount of lactate accumulation. That is when we can say that they are training well. Then there are certain subjective mood tests. There should be some willingness in terms of, sometimes there are psychological factors. You are not in the right frame of mind. So we ask these different kind of questions. There are certain questionnaires. How are you feeling? Your what your are you willing to train? What are you feeling? What is your mental status? Did you sleep well? So these are subjective kind of informative questions we keep asking, and it is all there on their wellness data. Recovery stress questionnaire. So that is something which we introduce once there has been an injury. So once the injury has been taken care of and the athlete says, yeah, it is fine, I can take care of myself, we need to understand at what level of confidence they are in terms of making sure that they can give there is sometimes a little bit of inhibition. Not everybody is like 100, and there is the little bit of residual reluctance that, oh, I just came out of an injury, what if I'm not able to push myself hard enough? So we give a questionnaire in terms of understanding their readiness and their willingness, or if there is an underlying problem or an underlying issue which they are not able to tell us or confront. Daily analysis of life demands of athletes. This is also very important. When did you sleep? How long did you sleep? What time did you wake up? Was there anything apart from training? Something happened in the school? Was there an exercise session which you did? All these things have to be communicated, and we have a system in place. It is not that everybody has to message everybody on a personal basis. There is a system in place, and if these questions are answered on a daily day-to-day basis, it gives us a lot of information which we can sit down with the coaches and have a strategy towards, so that none of you actually gets injured, or even if it happens, you come out of it in the least possible time with the maximum efficiency. So this is the whole emphasis. These things which are seemingly easy, people take it very lightly. People are still not putting in the details. But if you do it in the right way, this is the kind of information I get, and this is how I can help if you need to help me to help you. So this is basically how we can work together in terms of preventing a lot of issues before they arrive. The sports science aspect is something which is by itself a very large lecture. So that can be again taken care of, or I can always speak to people or have another session if people are interested in terms of how sports science essentially we can deep dive into it and have a profound effect on injury and injury prevention. But I have tried to brush up on most of the aspects as much as possible in terms of clarifying certain myths, in terms of making you understand why we do a certain thing and what is the reason behind it, so that you'll understand the seriousness of it, and also help us in terms of coming up with good strategies which will help you in return to win medals and be at the most physically fit status. That's about it. Thank you. I'm open to questions. Can you all hear me? Yeah, so I'm open to questions. If there are any questions, please. So I have got a few questions over here. Is bad posture and wrong technique prone to injury? Yes, definitely. That is what we try to assess and evaluate when we do the musculoskeletal screening. We would want to understand how the posture is, if there are any anomalies, if there is anything which we know will be at a risk for the athlete to perform. Then we try to not we try we definitely work on, we give a custom tailored exercise program for that athlete, and they have to work and follow that so that we can take care of these kind of issues like bad posture and wrong technique. So definitely it has to be taken care of. Now, the second question is, what about rest period? They have 1 day a week. Is that enough? So again, deep tissue massage. What is the gap they would, by the way, massage? And so this rest period, again, it's a very generic thing. So rest period also depends on the amount of effort that has been put in that week. So if it has been a relatively less amount of effort from the coach's effort, and from our end also, we've not been thrashing them, or for that matter, even if the it's not an in competition, it's a taper kind of a state. So the rest will depend on a lot of factors, and not just, we cannot say, we cannot confirm it, or we cannot just put it like, 1 week 2 days rest. We cannot have that, because a lot of thing depends. There are a lot of factors which makes us tell you that this is the amount of rest you need to take, and this is the amount of rest you should not take. I mean, like, you can go ahead. So we monitor the volume of the swimmings. This thing, we monitor the volume of dry land sessions. If there has been an injury, we understand the whole picture, and then we can tell you that this is the right. So there is no ideal rest day. It all depends on what the cycle is and what kind of a training zone we are in. The training zone will decide what kind of rest is required. Any more questions? Okay, 1 minute. I've suddenly got a lot of questions. 1 minute. So according to you, each athlete have to have a different warm-up, stretching. So more or less, yes, it will be, it's going to be generic, but there will be some key areas. So for one person, the shoulder will be of more problem than the leg. So for that, I will add 2 more exercises. So ideally, yes, I would want a custom tailored program for each and every athlete. There can be, out of 10, there can be 6 or 7 common exercises, because all of them are playing a specific sport. Like, they are swimming. All of them are swimmers. So 5 to 6 can be common. But there would be essentially 3 to 4 exercises which would be specific to that athlete in terms of specific issues which we have got from the screening and from the fitness test. So yes, there would be specific warm-up and stretching on and before. Is deep tissue massage still necessary now, and just trial and training happening? So deep tissue massage, again, I can take a complete lecture on that. But essentially what you would want to do is, what the purpose behind getting a deep tissue is to recover. So if you develop certain kind of strategies wherein your body is recovering well from the kind of poundage and the kind of training it has endured, then your dependence on this kind of deep tissue massages will reduce. You need to do it in a preventive matter. Deep tissue cannot be a sole reason to say that, oh, I have not got a deep tissue massage, so that is why I have not been training well. No, it is something that will sort things out for you. Obviously, on a regular basis, once you do it 2 to 3 weeks, you would want to be in a good frame and a physical fitness, but that cannot be a deciding factor in terms of whether the dry land training has to happen or not happen. I had an ankle injury last month. Am I good now, but still limping? Why? So again, that has to be evaluated. I'm sorry, I cannot tell you the reason why you are still limping unless and until I don't see or examine or completely come to an understanding what your current state of the ankle is. So I need to evaluate you first, and then only I can give you an answer why you are limping. For blood evaluation and musculoskeletal, is there? No, there is no limit to such things. There is no limit to blood evaluation. And blood evaluation, when I say specifically, I am looking towards certain parameters. I don't expect you to get everything under this roof. I mean, like they have thyroid, and they have this and that. So we have a custom tailored routine. We have already structured certain tests which we want you all to get assessed in terms of routine blood analysis. We do not expect you to do everything that is being tested at the lab. And musculoskeletal screening also doesn't have so for the younger group we do it, but the younger lot, say around age of 6, 7, 8 years old, they are going to grow eventually, so their body will change as once they start growing, as the whole process of growth is happening, the things will change in a very rapid. So after 18 or 19, again there is a very major growth spurt. So your MSK screening doesn't have any impact. We need to moderate that every 3 months or something, so it doesn't have a profound effect. Now, how would you decide muscle soreness post hard work and injury? So that is a very good question over here. There is a difference between soreness and injury. So we have tried to explain this. I will try to make you understand over here also, but it requires a lot of communication. Soreness is something which is going to happen any which ways. Soreness is your body's way of telling you that you have pushed yourself. So the kind of sluggish feeling, you feel that little bit of heaviness in your legs, you feel that, you are not able to walk, and there is a vague distributed pain. It's a vague distributed pain. It's not very focused. It's not very pinpoint over here. So if you worked a lot on your lower body, if you worked a lot on your quads, then your quads will start aching as a whole. It will not be one particular spot. So that is soreness. That is work-induced soreness. Your body has been thrashed to a limit where it has, and that is something which is very important. Overload principle is a very basic principle for you to get stronger. Unless and until you don't overload, you will not get stronger. So soreness goes hand to hand with overload. If you are overloading, you will get sore. And if you are sore, then that is a marker that you have pushed yourself to a good limit in terms of exerting good efforts physically. Pain is more or less pinpoint, that it has a very localized kind of an effect. Every time you do a movement, it gives you a sharp kind of an effect. That is pain. So there is a very marginal difference, but with a lot of communication you can understand this is pain, and this pain usually doesn't have a generalized kind of a effect. It is not. It is more or less focused, pinpoint. Okay. What if we get injury before a big competition? What should we do? So again, big injury. So that again, in order to explain you, there is nothing like big injury. You first of all, if you get an injury, irrespective of it being big or small, or you need to get yourself assessed by a clinician, by a physiotherapist or an orthopedic, and understand the gravity of the situation. Then conclude whether it is something where you need to continue to participate or you need to take some time out. So that will only depend upon how we decide and how well we understand the problem. So without examination, we cannot say that you should participate or you should not participate. So that clearly will depend upon the kind of state you are in at that point of time, and having a clarity in terms of how severe the injury is. What kind of stretches can we do after swimming and gym personally to free our body? Again, that is something I told you, we need to be specific. I've shared a sample program you can do. So for swimmers, I would say work on your hips, work on your shoulders, work on your trunk. That is something which is very common. So do those kind of stretches. Once injured, always injured. Is it a myth? No, it's a myth, absolutely a myth. Once injured, always injured. If an athlete is giving their best, and if they are not getting injured, they are not doing justice to the sport. Please get this clear. If you are doing and giving your 110% in your profession and as an athlete in your sport, you are bound to get injured sooner or later, and that is just a parcel of an athlete's life. And there is nothing wrong. So and you can absolutely we've got ample of examples to give people who have got horrible injuries, and they have come back and won gold medals. So it's a definite myth that once you get an injury, you are going to be. There is a lot of thought process needs to be understood. Again, there has to be a clear cut examination, and depending on that. But please do not have the kind of blocks that you're not going to be back into the. You can overcome things. Most of it depends on whether it's reversible or it's irreversible, and most of the musculoskeletal issues are reversible. Can say something about musculoskeletal screening. So in musculoskeletal screening, what we do is we have, so it is again specific to swimming. We do a lot of research. We have read a lot of articles, latest articles in terms of research happening around the world. And we come up and we choose best assessment tools. So we check the shoulder range, we check the neck range, we check the hip range, we check the knee range, we check the whole body's movements and mobility in general. And we have an objective measure. We use something called as a goniometer. How you use a scale, a normal scale. So that way we quantify. We check the flexibility. We check the mobility. We also check in terms of the posture, in terms of if there is something tight or loose or something of that sort. And then we come up with a report and we highlight things which are problematic, which we feel are key and which may lead to a problem in future. So that is how we go about a musculoskeletal screening. 1 minute, I've been getting too many questions over here. Massage once in 2 weeks is good enough, and all depends upon the level of activity the athlete is in. Massage again, it depends on that. Ideally, you would want your body to recover from the kind of this thing. People massage cannot be the deciding factor to say that whether I am in or out of the game. No, you need to get it on a regular basis, but once in 2 weeks is good enough. But again, that will depend upon. Sorry, but too many questions over here. Is swimmers are skipping swim down? No, I don't think so. Ideally, that needs to happen. I mean, swim downs. I have not come across somebody who's missed out on swim downs. Everyone. Injury, if you're having it doesn't matter whether you are participating in a national event or international event. Injury is injury. If you get any injury, if you have any discomfort, please soonest go to a physiotherapist and health practitioner, get an assessment, get a clarity of what is wrong, and understand the gravity of the situation. And then only we can understand. So it doesn't matter which level of competition you are. If you are not fit and if you are injured, irrespective of it being a national competition or an international competition, if you are not fit, you will obviously not be able to give your 100%. And if you're not able to give your 100%, you will not win. So why do you want to go into that state? So ultimately, it boils down to getting in and understanding what is wrong and then deciding whether we can still go forwards. Is there anything in between that we can manage, work upon in a short-term base and still participate? That can be done, but that has to be understood. Can you throw light on muscular cramps prevention? So again, most of the reason in research, I said, muscular cramps is again the body is in dearth of micronutrients, sodium potassium levels being low, lack of hydration has come out to be the maximum reason behind people getting cramps. So if you're not hydrated well, and if you're losing out a lot of fluid from your body, especially sodium potassium, and you are at high risk of getting cramps. So that is my number one suggestion. If somebody is getting cramps, just make sure that you are well hydrated and you are getting your recovery drinks and sodium potassium levels in line. Now our kids do more of land training without swimming 2.5 hours a day. Will this create injury to them? So over here, that's a very good question. What I would like to say over here, the question over here is, Mr. What he has asked is, since we are doing a lot of dry land training and we've been out of the pool, so I need to understand we as swimmers basically are not hardcore land-based athletes. So a little bit of discomfort and problem will arise because our training mostly 90% has been happening in the pool. So when you transition from one point to another, there is going to be that change is going to have some sort of an impact in your health. So, but it is nothing that you should worry about. Obviously, we need to be cautious about how to load. So this is exactly what I said, that now this is the very good question in terms of the example which I wanted to show in terms of the presentation I had. This is a certain transition from water to land. So if we do it in a very controlled fashion, and if we do it in a very well managed way, then I don't think so people will have issues. But if it is not done in a very controlled fashion, if there is a sudden spike, like suddenly I start loading them left, right, and center on a dry land, then they might have some adverse effects, which people do complain. I have knee pain. They started running. So it has to be, managed in a very scientific manner. There has to be an understanding of what to do, what not to do, and how to go about it. Can we get graphical analysis of our athletes? Yes, we will definitely share the reports with you, but we cannot put it up over here. We can have an individual conversation and then we can definitely sit down and discuss that. Can you say something about, yeah, I've said that, my daughter is 9, or do I have to worry about getting injured? Please, we don't have to get worried about injury. Please, I would want to, make sure that everybody understands. We don't have to get worried about injuries. We just have to be smart in terms of how to manage and tackle injuries. Injuries are bound to happen, but we need to understand and we need to have a strategy where we can first of all prevent them. And if at all, for XYZ reasons, if they occur, we come out of it in the shortest time. So do not be afraid of injuries. If you are not getting injured, you are not doing justice to sport. How do we know that if you do cold massage or hot massage? So hot massage and cold massage in an acute phase, first 48 hours, cold is the best way to go about. In the acute phase, first 48 hours, use cold. After that, in subacute, say chronic, cold doesn't have that kind of an effect. So after say 3 to 4 days, you can have something called as heating effect, or you can also have a contrast bath where you can do a mixture of hot and cold together. But acute stage, stick to cold. Subacute to chronic, say about after 4 days or say more than a week, move to heat. Can we apply cold pack regular after training? Yes, definitely. Please apply cold pack regularly, and especially if there are certain areas where you feel there is a lot of soreness happening. So if you feel that this has been overworked, immediately ice it. Ice it. What basically does, it creates a lot of recovery in terms of managing the kind of micro trauma. So when you work out, there is some sort of a micro trauma happening in your tissues. So ideally, when you sleep for the next day, the recovery, your body needs to be recovering from that micro trauma. So applying cold to certain areas which you have worked on after working out is very beneficial. In general terms, we also do something called as a cryo bath. We put our athletes into cryo chambers, bring down the temperature to 1 or 2 degrees or sometimes even minus, and that helps a lot in recovery. You don't have to stay there for a minute or two. You don't have to freeze to death, but then it helps a lot. 1 minute. I have overall stiff muscles. Please advise. You need to stretch. You need to foam roll. You need to do a lot of that rather than working on strength and power and endurance. Work on mobility and flexibility. People who have stiff muscles work on mobility first and then flexibility. If you don't have mobility, you will not be able to get 100% in flexibility. So you do need to do both mobility and flexibility. Forget strength, forget endurance for the time being. Later on, you can come back to that. Can we apply what do you suggest about asthmatic kids? Now again, what do you suggest about asthmatic kids? You missed. Yeah, asthmatic again. That's a different condition altogether. The reasons behind asthma are different. It can be allergic. It can be because of dust, or it can be certain. So the reason behind a certain clinical condition like this has to be understood, and necessary precaution has to be taken. If the exertion is going to be way too much, then it has to be taken. But it's not something to be worried about. There are many athletes who are asthmatic and they are doing brilliantly in their chosen sport. So it is not something which you need to be worried about. It can be managed and it can be taken care of if it is done in the right way, in the right time. If there is swelling, do we do cold pack? So swelling basically is a sign of inflammation. That is, again, it's a process, it's a stage in terms of how recovery is happening. So cold will definitely try to restrict the amount of swelling. So please, yes, do go ahead. If there is swelling, do apply it cold. And acute stage, it will help more. You want to restrict the kind of damage which is happening. Swelling is a reaction to some injury or trauma which has happened internally. So yes. Yes, swimming is a wonderful exercise in terms of improving on our mobility and flexibility. Just go ahead with that. It's a brilliant way to go about it. Any more questions? I think I have covered up most. Yeah. Do you have heavy load and weight training have a great impact on performance? Heavy load weight training, again, it is not about, I don't want over here, please understand, we want faster swimmers. We don't want bodybuilders. So heavy load and heavy training is not my agenda over here. I want you to swim fast, have the least timing, and get the best timings in terms of your own performance and achieve gold medals. And so the priority over here is not to lift heavier; it's to get faster. So my program will always depend upon making you fast as a swimmer rather than building your capacity to lift heavier weights. My back frequently pains after a very hard workout. What might be the problem? I need to assess this. I'm sorry, I cannot have this kind of a vague this thing. I need to evaluate you in order to understand what is wrong with your back.
Yes, just scroll down to the bottom. There are couple of questions. I think we can finish after this.
Yeah. In under 11, 2 days balance is okay. Yes. As of now, under 11. So I told you, I explained this before, that the younger lot, basically the growth is happening very rapidly. They are going to get stronger. So for under 11, rather than making them lift, I would want them to mold. I would work on their technique, their form, in terms of making sure that they understand what exercise to do and how to do about. Because that is the age when I want to mold them in a way so that once they become 13 or 14 years old, they can lift very good amount of weight and get stronger in that way. So at 11 and anything under that, my priority is to work on the technique and the form. So for that, 2 sessions in a week is more than enough, and provided that has to be practiced. It's not that 2 sessions with me and it's over. 2 sessions with me, and that has to be followed at home, and people need to be understanding that. So technique is of prime importance below 11, and rather than strength. My training of the muscles are tight and stiff is due to any deficiency. If you want deficiency, I cannot say. I mean, like, if your muscles are tight and stiff, that is a natural reaction to exercises. It's something called as hypertrophy. When you have exerted, when you have lifted, when you do any form of resistance training, there is going to be stiffness. You will have certain restrictions in terms of mobility, but that will calm down in, say, half an hour, 45 minutes. If the problem still persists, then understand and try to connect with a physiotherapist like me and understand why you are stiff. But exercises cannot inherently make you stiffer unless you combat it with a good cool down program, like a stretching program. You're welcome. Have you come across or heard of any concussion risk in competitive? In swimming, concussion I have not come across, but I was a part of cricket. I have come across a lot of concussion injuries over there, but in swimming, I have not come across. But concussion as itself, as a condition, has its own protocol. If there is a concussion, if there is something, there is a definite way where we can deal with it. And once we follow that, it is not a very severe kind of an injury.